Press the bell icon on YouTube and don't miss another update.
I am Dr. Shishir Bhatnagar. I am from Cloud9 Hospital, Noida. When I talk about respiratory conditions in children, there is a very big list with different age group. Let's start with children between the age of 3 to 5 years. So, are we facing too many respiratory tract problems these days? Yes, we are. Is it result of the pollution and other things? Yes, it is. Children more than 4 years are very prone for respiratory problems by virtue of their habits. One, they usually go out and play in the evenings. One, they are going to the schools in the morning, again encountering the pollution in the daytime. So these are the ones who are going to have maximum load of pollutants. Infections which are already present there, they are aggravated. Most of the infective conditions in children of this age group are viruses only. And children who have allergic tendencies, they wheeze quite a bit in this age. We have been seeing a lot of children in this age group having respiratory problems in the form of acute pharyngitis, allergic rhinitis, laryngitis, acute tracheobronchitis, the bronchitis per se, and viral wheezing, actually called as precipitation of the asthma. So these are the ones commonly condition. These are common conditions which these children are going to acquire. Most of these children are usually having viral episodes. They usually may remit in about 5 to 7 days time, but they may need some symptomatic treatment in this age group in the form of some anti-allergies or some bronchodilators, which may be helpful because during the bronchoconstriction, the airways are very tight inside in the lungs and they may feel very tightness in their chest. You may need some kind of a bronchodilation, either inhaled or taken orally, and the child may get some relief. The precautions should be, these are the children who should take good nutritious food in the form of proteins, good fluids, some symptomatic treatment for the allergies, and should see a respiratory specialist if these things are recurring again and again. It may be indicative of asthma or some respiratory problems. Another important problem in this age group is it may not be actually related to infections or pollutant. It may be a foreign body present in the lungs. So what happens is many a times a typical history comes that the child is coughing and people may feel that this is allergy or maybe a aggravation of an asthma or some sort of pharyngitis, but it may actually be a foreign body present in the airway. So again, the management will change totally because you will have to take that foreign body out. So between the age of 3 to 5 years, one should always keep a suspicion of foreign body if especially a child is coughing very bad and there is no previous history of these kind of coughs or allergies. Then we come on to the age between 1 to 3 years. 1 to 3 years old children are usually they are also very prone for infections by virtue of their immunity, because their immunity is not too good and they can, even a smallest of the infection can increase their problems. Most of the problems in this age group are again in the form of pharyngitis, laryngitis. There is a very particular mechanism which happens in this age group is ALTB, acute tracheolaryngobronchitis. This is usually a threatening event which happens and it actually can narrow down your airways, especially the trachea and the bronchi, and the child may have massive respiratory problem, maybe having a stridor also. So these are the ones different from the usual pharyngitis, laryngitis, the rhinitis, basically a flowing nose, nasal block, some hoarseness of the voice, some kind of kitch in the throat. That's very commonly encountered in these children. Again, some soothing things can be helpful, some soothing drugs can be helpful there. You may need some bronchodilation. At the same time, one should watch for any increase in the respiratory rate in these children, because if the respiratory rate increases, that means you are actually heading for a problem. Or if the respiration becomes too noisy. Again, in this age group also we may have some asthma and asthma exacerbations, one should be looking for it, if especially there is a history of allergies and these things are happening recurrently. Less than 1 year old children, they are usually they will encounter the infection only once the caregiver has it. It may be maid, it may be the grandparents, it may be the mother, it may be the elder sib also. So they are the ones, actually they are innocent bystanders, and they usually get infection because of somebody else transmitting it to them. Per se their immunity is very low, they are not very prone, they are not very used to seeing infections, and they aggravate their infections in a massive way. Again, in this age group one should be on a lookout for increase in respiratory rate, because a child will not, this age child will not give you much time and will not give you much warning signs also. They may suddenly land into more trouble. These are the ones, they may even, children less than 3 months, even with a small nasal block, will be a big trouble, because they will not sleep at all. A putting of a some saline nasal drops would really help this child. It can be even as mild as this, it can be even as aggravated as, or as serious as a kind of a bronchitis, wherein the airways usually shrink with a lot of exudates into the airways, and they are the ones who may need some oxygen help also, and may need a hospitalization, because the airways are too small, and the narrowing has happened to an extent where the air exchange is not happening much. So these are the ones we may need some kind of a hospitalization, or some fluids and some oxygenation. Most of these, as I told you, are viral in nature. They will need supportive therapy only. Most of these respiratory problems in any of these age group may not need antibiotics, but if there is a purulent tonsillar infection or a bacterial infection indication, one can start with antibiotic. Again, it should be in discussion with the physician or a pediatrician treating the child.